I want you to think about a conversation that happens every single day in bedrooms, in relationships between couples all over the world. And one person says, "Is it safe?" And of course, the other person, with complete confidence, they say, "Yes, we are in the safe days." And they believe it and they do so genuinely. And of course, they do that completely because they counted, they calculated, they checked the calendar, they did the math, and the math said it is safe. Now, I want to ask you something. For every 100 women who rely on the calendar method to avoid pregnancy, 25 get pregnant within a year. 25 out of every 100. Now, that is not a rare failure. That is not an unlucky edge case. That is 1 in 4 women doing the exact same calculation you did, getting the exact same answer that you got, and still getting pregnant. Now, today, I want to have the honest conversation that most people never have. Not to scare you, not to judge any choice you're making, but to show you exactly why your safe days may not be as safe as you think and what you can do about it. Because understanding your own fertility is not just about avoiding pregnancy. That is not the objective of understanding your own fertility. It is one of the most powerful things a woman can know about her own body. And you deserve the full picture, not just the calculation. You deserve the full picture. Now, real quick before we start, I checked my analytics as I've always done, and 98% of you are watching without subscribing. You know who you are. I would like to ask you to hit subscribe, tap the bell, and drop a comment telling me what health topic you want me to cover next. I read every single one. Are you done with that? Perfect. Just to remind you, I'm Dr. Libeya Bethwel and I'm your pharmacist. And I want to say something important before we dive in. Something really important before we dive in. Now, this video is not here to shame anyone's contraceptive choices. Every method of family planning, natural or medical, has a place. What this video is here to do is give you the science, the complete, honest science of how your cycle actually works, so that whatever choice you make it with real information instead of just assumptions that you pick online. Because I've seen too many unintended pregnancies that happened to people who genuinely believed they were being careful, who were doing the right math on the wrong understanding of biology. Now, I want us to fix that today, and I hope that you are ready. We fix it together. Let us start from the very beginning. And we start by understanding the calendar method. Now, the calendar method, which is also called the rhythm method or the safe days method, is one of the oldest forms of natural family planning in the world. Now, the basic idea is simple. Track your menstrual cycle, identify when you're most likely to be fertile, and avoid unprotected sex during that particular window. Now, on the surface, this may appear to be logical, it may appear to be reasonable and even elegant, but embedded in that logic are 3 assumptions, and every single one of them is where the method breaks down. I'll share the 3 assumptions with you. Now, assumption number 1 is that your cycle is a fixed length. Now, the calendar method works by taking your past cycle lengths and using them to predict future ones. Now, if your cycles are consistently 28 days long, you can estimate with reasonable accuracy, of course, when ovulation is likely to occur. But, and this is crucial, most women do not have perfectly consistent cycles. Even for those who have a regular cycle, there are many things that can delay periods and cause disruption, including stress, diet changes, or getting sick. Now, one stressful week at work, one international flight, crossing time zones, one illness, one dramatic change in exercise intensity, any of this can shift your ovulation by days, sometimes more than a week. And if ovulation shifts, your safe days shift with it. But your calendar does not know that. Your calendar is still showing you last month's pattern. Assumption number 2, and assumption number 2 is about ovulation, that ovulation happens at a predictable fixed point. Now, the calendar method works only for those individuals with very regular and predictable cycles. Now, most teaching around the calendar method assumes ovulation happens on day 14 of a 28-day cycle. Now, this is a statistical average, not a biological rule. Ovulation is usually 14 days before the next menstruation, not 14 days after the beginning of this one. Now, ovulation happens approximately 14 days before your next period, not after your last one. In a perfect 28-day cycle, those two calculations give you the same answer, but your cycle is not always 28 days. And that is where millions of calculations go wrong. If your cycle is 30 days, ovulation likely happens around day 16. If your cycle is 32 days, around day 18. If stress shortens your cycle to 24 days this month, ovulation may have happened on day 10, a day most people consider deeply within the safe zone. Assumption number 3, and this is important, is that an egg can only be fertilized for 1 day. Now, this one is true. Once released, an egg survives for approximately 12 to 24 hours. After that window, it cannot be fertilized. And here is the part that changes everything. The sperm was not waiting for the egg. The egg had to wait for the sperm. And sperm are extraordinarily patient. Now, I want us to move and look at something different, and that is the sperm problem. And it's about the biology that nobody tells you. Now, this is I want you to pay attention, because this is a section that surprises most people, and it is the single biggest reason the calendar method fails more often than people expect. Now, sperm survival depends on the environment they enter. Under ideal conditions around ovulation or when cervical mucus is supportive, sperm can survive up to 5 days inside the female reproductive tract. 5 days, not hours, not days. Sperm can survive inside the female reproductive tract for up to 5 days, although the average lifespan is typically around 3 days. Now, let me show you why this completely changes the safe days calculation. Okay, imagine your cycle is 28 days. You calculate your fertile window as days 12 to 16. So you consider days 1 to 11 and days 17 to 28 as safe. You have unprotected sex on day 9. Day 9 feels deeply safe, well before the fertile window. But those sperm do not die within hours. They find the cervical mucus, which is beginning to change even before ovulation, and they survive for 3 days, for 4, for 5, and then ovulation happens on day 13. 2 days earlier than your calculation predicted because of a mild stress response that you had that month. Now, the sperm that entered on day 9 are still alive. They have been waiting in the fallopian tubes, patient and still viable. The egg drops, fertilization occurs, and yet, by the calendar, that day was safe. Now, sperm cells can stay alive for up to 5 days. I'll insist on that, inside the female reproductive system, under the right conditions. Now, this means that even if intercourse happens as of a few days before ovulation, pregnancy can still occur because the sperm may still be alive when the egg is released. Now, the calendar told you day 9 was safe, but biology had a different plan. Allow me change gears and look at something different. And this is what I call the cycle variability problem, why your history lies to you. Now, let us talk about the fundamental mathematical problem at the heart of the calendar method. And the calculation is based on your past cycles. You track 3 months, 6 months, 12 months of data, and you use that history to predict your future. But here is the thing about predicting biology using history. Your biology is not a machine. It is a living system that is responding to your environment in real time, and your environment changes constantly. The calendar method improves with consistent tracking but never becomes fully viable on its own. It is best understood as a tool for body awareness rather than a contraceptive strategy. Now, let me give you a real-world example of how cycle variability undermines the calculation. A woman tracks her cycle for 6 months. Her cycles range from 26 to 30 days. Using the standard calendar method formula, she subtracts 18 from her shortest cycle to find the first fertile day, and subtracts 11 from her longest cycle to find the last fertile day. Now, 26 minus 18 equals to 8. So her fertile window starts on day 8. Now, 30 minus 11 equals 19. So her fertile window ends on day 19. That means she considers day 1 to 7 and days 20 to 30 as safe. But in month 7, work becomes extremely stressful. Her cycle extends to 34 days. Ovulation shifts to day 20. Now, day 20 was the first day of her calculated safe zone. She had unprotected sex. The calendar said safe. Her ovaries had other plans. Now, the typical use failure rate for fertility awareness method is around 12 to 24%, meaning roughly 1 in 8 women relying solely on this method may experience an unintended pregnancy within a year. For context, so that you understand it better, contraceptive methods like the pill or IUD have failure rates well under 1%. With typical use, the gap is significant. Allow me shift to something different, and I want us to look at the factors that shift ovulation without warning. The factors that shift ovulation without warning. Now, I want to give you a specific list of the things that can shift your ovulation and therefore silently invalidate your safe days calculation without you feeling a thing, because this is the information that most calendar method guides leave out entirely. Number 1, we talk about stress. Now, this is the biggest one. When you are under significant stress, be it physical or emotional, your body releases cortisol. Now, elevated cortisol disrupts the hormonal cascade that triggers ovulation, and the result is delayed ovulation. So sometimes by days, sometimes it can be more than a week. You had a difficult month, a relationship crisis, a demanding deadline, an illness in the family, and your cycle shifted, but your calendar did not. Number 2 is illness. A fever, an infection, any significant illness can delay ovulation. Now, your body prioritizes fighting the illness over reproductive processes. The cycle resumes, but it resumes later than expected. Another factor, the third one, is significant changes in body weight. Now, dramatic weight loss or weight gain affects estrogen levels, and estrogen is central to the ovulation trigger. Women who lose weight rapidly, who have eating disorders, or who gain significant weight quickly may experience irregular or anovulatory cycles. These are cycles where ovulation does not occur at all or occurs unpredictably. Fourthly is intense exercise as another factor that may interfere with the ovulation. Now, athletes, women who suddenly significantly increase their exercise intensity, or those in very high demanding physical training may experience changes in ovulation timing or even temporary loss of periods, and this is called amenorrhea. The other factor is travel and time zone changes. Your hormonal rhythms are partly governed by your circadian clock, and this is the body's internal timekeeper. Now, crossing multiple time zones disrupts that clock. It disrupts the circadian rhythm, and some research suggests this can temporarily shift ovulation timing. The other factor is breastfeeding and postpartum cycles. As we covered in the breastfeeding video, high prolactin levels during breastfeeding suppress ovulation. But as breastfeeding frequency decreases or supplementary feeding begins, ovulation can return. And predictably, the first few postpartum cycles are notoriously irregular. The other factor could be coming off hormonal contraception, then that is after stopping the pill, the implant, or the injection. Cycles often take months to regularize. Now, during this transition period, ovulation timing is highly unpredictable. Now, using the calendar method in the first 6 months after stopping hormonal contraception is particularly unreliable. The critical point is this that I want you to pay attention to. None of these factors announces itself. Your calendar does not know you were stressed last week. Your calendar does not know you travel across 5 time zones. Your calendar assumes this cycle will look exactly like the last one. And sometimes it does not. It does not look like the last one. Allow me to move to the next bit, and that is what typical use versus perfect use actually means. Now, I want to explain a concept that is fundamental to understanding all contraceptive effectiveness data, because without it, the numbers can be genuinely misleading. Now, every contraceptive method is assessed in 2 ways. There's a perfect use and there's the typical use. Now, a perfect use is how the method performs when every instruction is followed precisely every single time. In typical use is how the method performs in real life, with human error, inconsistency, and variability factored in. Now, the gap between those 2 numbers tells you how much the method depends on flawless execution. In a clinical trial, the typical user pregnancy rate of the standard days method was approximately 12 per 100 women per year. The pregnancy rate was less than 5 per 100 women per year with correct use. So with perfect execution, tracking every cycle meticulously, applying the formula correctly every time, abstaining completely during the fertile window without exception, the failure rate drops to under 5%. But with typical use, the way most people actually use it, the failure rate is 12 to 25%. Now, the discipline required to keep accurate records of menstrual cycles and to abstain from unprotected intercourse makes imperfect use fairly common. Now, the typical use failure rate of calendar-based methods is 25% per year. Here is the honest question. Are you using the calendar method with perfect discipline? Are you tracking every cycle for at least 6 months before relying on the data? Are you applying the formula correctly every single time? Are you accounting for cycle variability every month? Now, most people are not. And the gap between how they think they are using it and how they're actually using it is where unintended pregnancies actually live. Now, having said that, allow me cover something different that I think you need to understand, and that is on enhanced fertility awareness, the method that actually improve reliability. Now, and this is important, I'm not telling you that natural family planning cannot work. I'm telling you that the calendar method alone is not enough, and that there are far more reliable versions of fertility awareness that most people have never heard about. There's what we call the basal body temperature method. The basal body temperature method. And in this method, the woman records her temperature every day after waking up in the morning. Now, around ovulation, there will be a slight increase in her temperature. After ovulation, progesterone causes a measurable rise in your resting, or what we call the basal body temperature, and typically 0.2 to 0.5 degrees Celsius. This rise confirms that ovulation has already occurred. Now, the limitation of this, it confirms ovulation after the fact. It tells you that your fertile window has passed, not that it is coming. So it is most useful for identifying the safe days after ovulation, which are genuinely very safe. We also have the cervical mucus method, and this is what we call the Billings method. Now, before ovulation, the secretions from your cervix will be cloudy, scanty, cloudy, sticky. Around ovulation, the secretions become abundant. They become watery and clearer. Now, fertile cervical mucus at ovulation looks and feels like raw egg white, clear, stretchy, slippery. This change is caused by rising estrogen and signals that ovulation is approaching. Now, learning to read cervical mucus is more reliable than the calendar alone because it responds to your actual hormone level right now, not to last month's histories. It accounts for cycle variability in real time. Now, there's what we call the symptothermal method. This is the most reliable natural method, combining basal body temperature tracking, cervical mucus observation, and cycle length data simultaneously. Now, by using multiple biological signals together, rather than one alone, the symptothermal method achieves significantly higher accuracy. When used correctly and consistently by motivated, trained users, it can approach the effectiveness of low-dose hormonal methods. Now, the key phrase there is motivated, trained users. This method requires commitment, consistent practice, and ideally guidance from a certified fertility awareness practitioner. There is also the modern technology that you can use, and this I'm talking about apps like Natural Cycles, which use algorithms to analyze cycle data. We have basal body temperature and additional biometric inputs to identify fertile and unfertile days with greater precision than manual calculation. Now, the NHS is clear that fertility awareness methods require proper instruction and consistent practice to be even moderately effective. And without that, the margin for error is very wide. Now, technology can assist, but it cannot replace understanding your own biology. The app is only as accurate as the data you give it, and the data you give it depends on consistently daily measurement. Now, allow me move to another part, and this is a pharmacist guide to contraceptive options, and I want to give you the full picture. Now, as your pharmacist, and I want to give you a brief, honest overview of the contraceptive landscape because the calendar method is one option in much wider menu, and understanding that menu helps you make the most informed choice for your specific life, for your health, for your relationship, and goals, of course. We have the barrier methods, and this include condoms, diaphragms, etc. Now, condoms are the only contraceptive method that also protects against sexually transmitted infections. They have a typical use failure rate of about 13%, meaning 13 in 100 women using condoms as their only method becomes pregnant in a year. Now, much of this failure is due to inconsistent or incorrect use rather than product failure. We have female condoms, we have diaphragms, we have cervical caps, which are alternatives, each with their own effectiveness, profiles, and usage requirements. Another method is combined hormonal methods, and here we're talking about the pill, the patch, the vaginal ring. Now, the combined contraceptive pill containing estrogen and progesterone prevents ovulation. Now, with the typical use, the failure rate is under 7%. With perfect use, it is under 1%. The patch and the vaginal ring, they work via the same hormonal mechanism, but are changed weekly and monthly respectively, which some users of course find easier to comply with consistently. We have progesterone only methods as another method, and this we have the mini pill, the implant, the injection. Now, the progesterone only pill or mini pill is taken daily without a hormone-free week. It works primarily by thickening cervical mucus to prevent sperm penetration, and in some women also suppresses ovulation. Now, the timing window for taking it is stricter. It must be taken within a 3-hour window daily. Now, the contraceptive implant, a small rod that is placed under the skin of the upper arm, releases progesterone continuously for up to 3 years, and it is one of the most effective methods available with a failure rate of less than 0.1%. Now, the contraceptive injection, given every 8 to 12 weeks, depending on the formulation, is highly effective but requires regular clinic visits. Now, we have long-term reversible contraception, and by this I'm talking about the IUD. Contraceptive methods like the IUD have a failure rates under 1% with typical use. Now, the hormonal IUD, such as the Mirena, I think you've heard about the Mirena, releases small amounts of progesterone locally within the uterus, and it lasts 3 to 8 years depending on the type. The copper IUD contains no hormones, and it works by creating an environment toxic to sperm. Now, both are among the most effective forms of reversible contraception that is available. We have emergency contraception as another type of contraceptive, and this is for when the plan fails. Now, emergency contraception, commonly called the morning after pill, does not end a pregnancy. It works by delaying or preventing ovulation if taken quickly after unprotected sex. Now, the progesterone-only emergency pill is most effective when taken within 72 hours of unprotected sex, but can be taken up to, around 120 hours. Effectiveness of this method decreases with time. You have to bear that in mind. The copper IUD, on the other hand, inserted within 5 days of unprotected sex, is the most effective form of emergency contraception that is available, with a failure rate of under 1%. Now, as your pharmacist, I want you to know that emergency contraception is a medical option, not a contraceptive strategy, not a regular method, but when it is needed, it is available. And knowing that information in advance is far better than finding out in a panic at 2 a.m. Now, who should not rely on the calendar method? Who should not rely on the calendar method? Now, in the spirit of complete honesty, let me be very specific about the women for whom the calendar method is particularly unreliable. Number one, these are women with irregular cycles. If your cycles vary significantly in length from month to month, the calendar method gives you very little meaningful data. You cannot predict a pattern that does not exist. Number two, teenagers and young women. Now, cycles in the first few years after menstruation has begun are not notoriously irregular as the hormonal system matures. Now, calendar-based methods are particularly unreliable in this population. We have women approaching perimenopause as the third category. As estrogen levels begin to shift in the years before menopause, typically from the mid-40s onwards, cycle length and ovulation timing become increasingly unpredictable. Now, many perimenopausal women are surprised by unintended pregnancies precisely because they assumed their irregular cycles meant reduced fertility. Now, the other category, the fourth category, these are women with polycystic ovarian syndrome. Now, PCOS is characterized by irregular, unpredictable cycles and irregular ovulation. Now, the calendar method is essentially unreliable for women with PCOS. If you have been diagnosed with PCOS and are using the calendar method, please speak with a healthcare provider about more reliable options. The other category of women, we have women who have recently stopped hormonal contraception. And as I mentioned earlier, the first 6 months after stopping the pill, the implant, or any hormonal method are a period of hormonal recalibration. Cycles during this time are highly variable. Now, calendar predictions based on contraception data may bear no resemblance to what your body is doing now. The other category are women who are breastfeeding. Now, the return of ovulation during or after breastfeeding is unpredictable. The first ovulation after childbirth occurs before the first postpartum period, meaning you can get pregnant before you even know your cycle has returned. And let me bring this all together. The calendar method is not worthless. It is not worthless. It is based on real biology. Understanding your cycle, tracking it, observing it, learning its patterns is genuinely valuable knowledge about your own body. But the calendar method alone, used without additional fertility awareness science, without understanding its limitations, without according or accounting for cycle variability, has a typical use failure rate of about 25% per year, 1 in 4 women per year, and most of those women believed they were being careful. Here is what I want you to take from today. If you're using the calendar method, understand its limitations fully. Track your cycle for at least 6 months before relying on it. Learn to read your cervical mucus. Consider adding basal body temperature tracking. Use barrier protection during any cycle where something has disrupted your normal pattern. You could talk about stress, illness, travel, weight change, etc. So if you want the reliability of a natural method without relying on a calendar, calculations alone, look into the symptothermal method and consider guidance from a certified fertility awareness educator, not the calendar alone. And if you want the highest reliability, speak with a healthcare provider or pharmacist about the full range of options available to you, because the right contraceptive is the one that fits your health, your relationship, your values, and your life. And there are more options available than most people realize. Knowledge is the beginning of every good decision. And today you have more of it. Share this video with someone who needs it, someone who has asked, is it safe? And been given a calendar calculation as the only answer. Someone who deserves the complete picture. Drop a comment below and tell me, are you a calendar method user? What questions do you still have? And tell me what health topic you want me to cover next. Remember to subscribe if you have not already done so. Tap the bell. I will see you in the next video. I'm Dr. Libeya Bethwel, your pharmacist. See you.